All right, so we are going to be talking about our mystery molecule, which was FBN1. So the name and location. So the name of this molecule is Homo sapiens fibrillin-1, FBN1 mRNA. Other names include FBN, FBN1 human, fibrillin-1 Marfan syndrome, MFS1, SGS. And it is located on chromosome 15, Q arm 21 sub band 1. And we can get good for the next. So fibrillin-1. So fibrillin-1 is a large extracellular matrix glycoprotein that serves as a structure component of a 10 to 12 nm calcium binding microfibrils. So these microfibrils are what is used to create connective tissues. And then flaws in this molecule can have various outcomes, which we will outline in the following slides. So associated disease. So the disease associated with the fibrillin-1 mutation is called Marfan syndrome. So the symptoms are sunken chest, pectus exuvadium, which you can see in the lower right-hand side of the screen, and overgrowth of long bones, tall frame. So like this gives a tall and slanky frame to those who have this mutation, which you can see kind of like with the hands. And then you have aortic root aneurysms, which is like a bulge. Aortic root aneurysm is a bulge where there shouldn't be one, in this case, like in the aorta. And then less common is the cloudy eyes, ectopia lenticels. Only about half of the people have this, but as you can see in the top right, in a little diagram of the eyeball, what happens is that the connective tissue, due to the mutation in the fibrillin, they are not strong enough and they'll actually detach, which can, it will make the lens dislocation occur, which is what you see in that image. And the prevalence, so this is fairly common, about 1 in 10,000 to 20,000 individuals experience this. It affects men and women of all races equally, regardless of age. So, patient outcomes. A majority of the people with this mutation live. The mutation becomes lethal if the connective tissue in the aorta is diminished, leading to an aortic aneurysm. And that's due to the weakened connective tissues that we talked about earlier. And the treatment of this mutation includes blood thinners to reduce blood pressure and also reduce the stress on the aorta. And the mortality rate, however, is higher with newborns. So we're going to talk a little bit about aortic root aneurysms. So this is usually lethal if not treated, but it can be fixed with surgery sometimes. And as you can see, the bulge in the aorta causes abnormal blood flow. And then specific mutations. So the mutations occur all throughout the fibrillin-1 gene. More than 1,300 mutations have been observed. The most prominent forms of Marfan's exhibited mutations in exons 24 through 32. 25 of the mutations are new and 75 are inherited autosomal dominantly. The most common is missense mutation, which creates a cysteine molecule. And then frame shift, nonsense, and deletions have also been reported as mutations. And now I believe I will pass it over and we can get a little bit more in depth.
Awesome. Yes, so the most common, like Kaden said, is the missense mutation creating this cytosine molecule. So just that substitution of those bases. So moving on to the mRNA transcript. So the length of the actual transcript of the FBN1 gene is about 11,695 bases. And that was according to the information we found on the PubMed website. Differences do exist between the wild type and each mutant type, but again, there are several different mutations, about 1,300. So it's hard to nail down exactly what those differences are. But generally, most commonly, we see most differences are found in the exons exons 24 through 32 of the mutant strand. But again, it can range, and usually it's more than just one missense mutation. It can be, again, up to 1,300. So, but they are usually various point mutations that are involved. So here we see the exons and introns. So in FBN1, we have 65 coding exons normally. And here I have two diagrams of the wild type. That should say here, not here. But the locations of the mutations are indicated. We can see on this right side image, the colorful one. All of the thick bands indicate the exons, the coding exons. And then where we see these red arrows with letters and numbers are the various mutations. So again, most of them are between that 24 to 32 range right here. But we do get some over here, and it really depends on the person. You can get some kind of wherever, and I think they're still mapping it out quite a bit just because of how widespread the mutations are. But and down here is just kind of another structure or another diagram that shows this. So this would be the gene, and all of these thick bands would represent the exons. So all of these long stretches then are introns that are not coding, but the exons are actually coding for the fibrillin-1 that is used to make connective tissue. So the protein product, like I just said, of FBN1 is, well, I'll talk about it in a minute, but the wild type versus mutant. So normally in both, we have 2,871 amino acids in both. And because the mutations are normally missense mutations, that number doesn't change too much. But since frame shift ones and deletions have been reported, occasionally we'll get less amino acids than that. But generally it's the same. Usually mutants have a change in one amino acid, but again, that one can vary. And what these mutations do is they render the protein fibrillin-1 that FBN1 usually codes for ineffective, and therefore it cannot add to the structural integrity of the microfibrils that are needed for connective tissue. And we'll kind of dive in a little bit more to what that does to create those symptoms now. So here we go, the structure and function relationships between the wild type and mutant type. So again, in the wild type, usually FBN1 will create the fibrillin-1, the component of microfibrils, and this will allow for normal elasticity in flexible tissues. So we see this particularly in the eye, skeletal muscle, and aortic blood vessels, like Kaden mentioned. If you can remember that diagram with the eyes, the lens was a little bit off-put because there wasn't a connective tissue holding the bottom lens in place, and that was due to no fibrillin-1 being present in the connective tissue. Which then would render it ineffective. And we can see that then in the mutant types, when it's not created, then we get the weakness or instability of connective tissue, like in the cloudy eyes. Also in skeletal muscle, normally when we have fibrillin-1, then our skeletal muscle is intact and it's keeping our bones where they're supposed to be. That's the function of muscle, is to move bones. But when we get weakened skeletal muscle, then it can't control the bones as well. And that's where we get that sunken in chest or the protruded chest, because the bones are either sunken in due to weakened skeletal muscle or it's pushed out due to too much. And we see the too much too kind of outlined here. So when we don't have this protein, our body tries to compensate by activating the TGF-beta growth factors in our body, which just creates kind of more connective tissue, but it's not as elastic as normal connective tissue is supposed to be. So this leads to less elasticity, more rigidness, or overgrowth and instability. And this is what happens with the aorta as well. Normally we have normal elastic blood vessels that can constrict and dilate normally, but when we don't have this protein, then we get weak aortic muscles, which can lead to an easier time having an aneurysm, which then could potentially burst and be lethal, as a tear in your heart is usually lethal. But generally that is kind of what is happening with the structure and function between the wild type, which again is the normal, most common type of not having this mutation, and then the mutant type. So disease mechanisms. So the mutations, like I said, disable the construction of fibrillin-1, which is a glycoprotein, and this is an essential piece of creating the microfibrils that are present in the extracellular matrix of connective tissue. So basically, again, if you have a mutation in this, that's going to weaken the elastic tissue in your body that helps your muscles be normal and helps everything be where it's supposed to be, and can create this kind of scenario where you can either have those long hands, long bones, or dislocation in the eyes, whatever it may be. Like, yes, right here we have the sunken chest. Like I said, if you have too much skeletal muscle protruding out, it will protrude your bones out. Too little will cave it in. The cloudy eyes, and then the lethal aortic root aneurysms. So also we have the overgrowth of long bones. So this protein is also found in long bones. And so when it's not created, again, our body compensates and makes more of this other protein that will cause us to become taller and thinner generally. So that's what we see in the majority of the population with this disease. And there we go. Here's our bibliography. Yeah, that's what we got. Thanks for listening. And I will stop recording now. Okay.